Hello, my dear students. I'm Dr. Vaishali Bharambe, Professor Anatomy. Thoracic outlet syndrome sounds like an anatomical term, but in reality, it's a clinical problem. So, why does this occur? To understand this, we must understand the apex of the lung and its relations, because every symptom you see in thoracic outlet syndrome is nothing but compression of these structures. So come, here is the apex of the lung. So we're going to ask ourselves some important questions. Where is the apex? What are the structures related to the apex? What is the applied importance? And what is thoracic outlet syndrome? Okay, so these are the questions we are going to try and answer now. Come. Here's the first rib, and everything above the first rib is the apex of lung, right? So, what and where is the apex of lung? The apex of lung lies above the first rib and cartilage. Relations of apex of lung. Now, please use your hands, okay? If this is the apex of lung, it's covered by cervical pleura, of course. Remember, lung is always covered by pleura, visceral and parietal. So imagine there is visceral, then there is pleural cavity, and there is cervical pleura, okay, parietal. Above that, you have another layer called the Sibson's membrane, okay. So above that, it's related to a lot of important structures. So let's try this again. Apex of lung covered by pleura, covered by suprapleural membrane, and then related to a lot of very important structures in your neck. I want you to, at this point, put your hand above your clavicle, okay? See, here's the clavicle. Put your hand inside, okay? On one side maybe. And this is the gap. If you press it deep, your fingers almost touching the apex of your lung. That's how superficial and exposed is the apex of your lung. Okay? Right. So take a look at beautiful images for you to enjoy the process of learning. This is the lung. It's rising here above the first rib, covered by cervical pleura. This cervical pleura is now covered by Sibson's fascia or suprapleural membrane. Okay, this fascia gets attached to the inner border of first rib, and the upper end of which is attached to the tip of transverse process. Maybe it's a way of protecting the apex of lung. And then now you see the fantastic image here. Shows you the suprapleural membrane related to some very important structures, starting with Scalenus anterior muscle, in front of that subclavian vein, behind it subclavian artery, and further behind it brachial plexus. In fact, if you are smart, you could put your hand in here. I can feel my subclavian artery going up. You should also be able to feel that. Okay? Come on, try it. Right. So you should be able to imagine at this point the apex of lung covered by cervical pleura, covered by suprapleural membrane, related to these very important structures like subclavian vein, artery, and brachial plexus. Okay, why are we discussing all this? We'll come to it. Posteriorly, the same apex of lung is related to four structures. You can use the mnemonic S1, S. First thoracic nerve, superior intercostal artery. First posterior intercostal vein, sympathetic chain. S1. Sympathetic chain, first posterior intercostal vein, superior intercostal artery, first thoracic nerve. S1, posterior relations of your apex of lung. What are the structures it's related to in the midline? These structures. So that means what are you seeing? Esophagus, the thoracic duct, the trachea, and a lot of nerves. Can you see there's so many nerves here? Recurrent laryngeal nerve of the left side, right vagus and phrenic, left vagus and phrenic. In the center, it's just left common carotids also seen. So these are all the midline relations. Now, I want you to understand that this is the apex of lung, anteriorly related to three important structures: Subclavian vein, subclavian artery, brachial plexus. Posteriorly related to S1. Medially related to esophagus, thoracic duct, trachea, and vagus, phrenic. Okay, so apex of lung is related to some very important structures, right? Now let's talk about some applied aspects. Why did I discuss so much with you? Because sometimes these structures can be injured if somebody is trying to harm someone. Just take a knife and put it in behind the clavicle. It's going to go directly into the person's apex. I'm not saying try, not at all. Okay, but this is how it is. Worse than that, you have something called as thoracic outlet syndrome. Come. So what is thoracic outlet syndrome? So you should just imagine that there is some injury in this region. Okay, the cause of injury can be variable, but the structures which are going to be damaged are all of these, right? So imagine that you have an extra rib here. Instead of first rib, you have a cervical rib also. Or you have a fibrous band of cervical rib. Or you have hypertrophy or spasm of that scalenus. I told you that scalene muscle going into spasm. Or you can have a narrowing of the costoclavicular. Remember, first rib crossed by clavicle, the gap is narrowed. Or maybe you have a Pancoast tumor. Pancoast tumor of the apical lung, right? So for all these reasons, the apex of the lung begins to get compressed. What symptoms will you get? So first, let's compress the subclavian vein. Because the vein is compressed, okay, the face of the patient can be edematous, the upper limb can be, on that side can be swollen, bluish discoloration of the upper limb because venous blood is not draining that easily, right? Similarly, would you be able to feel the subclavian pulsations? No. Beyond that, would you be able to feel the radial pulsations? They are weak because the artery is getting compressed. Okay? The limb is looking cold, limb is looking pale. Now let's talk about the nerves. Okay? So pain, numbness, tingling along the medial aspect because lower brachial plexus, remember T1, C8T1, is getting compressed. Ulnar nerve is getting compressed, so the ability to move his hand is hampered. Maybe the phrenic nerve, which is crossing the subclavian at this point, could be also involved, resulting in diaphragmatic paralysis of that side. Or you may have a hoarseness of voice if the tumor is on the left side, compressing the left recurrent laryngeal nerve. So these are all symptoms of thoracic outlet syndrome. And this is asked very often as a theory question. Do please study this. And the best way to answer this is do it systematically. Know your section at the level of T1. Know the apex of lung and its relations and go systematically. Venous symptoms, arterial symptoms, nerve-related symptoms. Then there is more chance of you getting the whole thing correct. So I hope you're enjoying this lecture. If you are, then please like, share and subscribe to my channel and hit that bell icon. Students, do please visit my website, which gives you a lot of downloadable notes, other videos, surgical anatomy videos, histology, draw and label, and MCQs. My website is vbanatomy.com. Link is given in the description.